Morning. As I've been presenting, my name is Vânia Maphossa, and I will be presenting the work entitled Cytokine Profile and Association with COVID-19 Disease Severity in Maputo, Mozambique. I had no conflict of interest to declare and to say that this study was approved by the National Ethics Committee. As a background, when we talk about SARS-CoV severity, COVID-19 severity, we start by the infection on the lungs caused by the SARS-CoV virus. And this infection will elicit an immune response, an innate immune response that is marked by the activation of cells like our NKs, our dendritic cells, and other macrophages. And this innate immune response will start producing what we call pro-inflammatory cytokines, such as IL-6 and IL-1. And these cytokines will be important for the recruitment and activation of more cells to the response. What happened in the severe cases is that some individuals will have this response exacerbated. We have the over response, and this will cause the killing of a massive killing of our T cells in the process called pathogenesis, and these will generate more recruitment, more cytokine secretion, and eventually we will end up with a cytokine storm. And this cytokine storm will also cause cell damage, and these individuals will present a systemic inflammation that is marked by a multi-organ failure and eventually can end up in death. When we discuss severity, there is a need to have what we call biomarkers, which are parameters that will help us identify and follow up these participants, these individuals, to see if they are developing a severe case. So far we already know by the researchers that we have some biomarkers that have been found to be associated. We talk about the viral load, that is the quantity of the virus in the body. We talk about the acute phase protein, such as C-reactive protein. We talk about parameters connected to the blood, with neutrophils and the red cell width, that is the size of the erythrocytes that it produces. And also, it's known that our cytokines they are associated to the severity, as an increase in cytokines such as IL-6, IL-8, and TNF-alpha has been associated to severity. And some articles argue that this can also be used as biomarkers of prognosis and outcome of this disease. But what is not represented in these studies is our African population. We had yesterday 2 presentations calling for information, calling for what are the biomarkers, what is happening with the African population. So this work is all about that. So. We aim to evaluate the relation between the serum cytokine levels, the clinical presentation, and classical biomarkers of COVID-19 severity on African population. Just to note that in Mozambique so far we had 230 cases, or cumulative cases of COVID-19, and that ended up in 2,000 deaths. So how we did this work? Well, it was done in Mozambique, in Maputo city, our capital, and in this, in a cross-sectional observational study, samples from SARS-CoV-2 RT-PCR were collected between February 21 to January 22. Just to note that we have 3 outbreaks in this period. So individuals aged above 80 years on SARS-CoV surveillance of Instituto Nacional de Saúde in Maputo. And we also had individuals from isolation centers in the Hospital Central de Maputo and Hospital Geral do Paranacaníço. So from this cohort, we selected 85 participants that were SARS-CoV RT-PCR negative and positive, and also had results on biochemistry, total cell blood count, and biobank and plasma. So because of the time, I will go a bit fast. So these, at the individual level, we collected this information, and with the biobank that I mentioned before, we did the cytokine analysis with 15 cytokines, and these analyses were performed in the MagPix analyzer, and the mean fluorescence intensity was used to as a measure. As a result, this is the first, in this table we are showing the study population characteristics. It's important to note that our severe cases were mostly men, and they presented they are oldest in our group. And interestingly, we didn't see any differences in CT value of the groups that we had over there. And we also did not, but we saw differences between the other biomarkers such as neutrophils and C-reactive protein that we said that are SARS-CoV biomarkers important. And following up for the results, because we have 15 cytokines, we decided to have an overview of what is happening with our study sample. And first, what comes up is that IL-18 is the most differentiated cytokine in our group, and IL-18 is telling us more. It's telling us it's distinguished better than the other cytokines. And to know that IL-18 is a cytokine of the innate response. And more than that, we also could see that we can differentiate two different clusters. We call it one cluster a pro-inflammatory profile marked by pro-inflammatory cytokines like IL-6 and TNF, and a second cluster marked by, we call it mixed inflammatory profile, because besides we have some inflammatory cytokines such as IL-18, we also have IL-10 and TGF-beta, which are anti-inflammatory cytokines. That's why the mixed inflammatory profile. And we wanted to see if these new components that we have constructed, if they had association with our SARS-CoV biomarkers. And yes, the PC2 component that is weighted most by the mixed inflammatory profile had a correlation with C-reactive protein in neutrophils, showing that these cytokines they have a role in the exacerbation of the infection. And if we put some column in our graph in order to see or identify our participants, we can see that these cytokines, they can distinguish, they can separate our groups, two main groups, our severe cases in red and our negative cases in blue. And if you remember for the previous graph, on that position, we also had our profiles, our pro-inflammatory and our mixed inflammatory. So that's take us, as I said, for the question, how the cytokines behave by group, what is happening by each group. And first, we will look at the pro-inflammatory profile cytokine, and what we can see in all the graphs that these cytokines levels are decreasing from the negative participants for the severe cases, especially in the IL-6, TNF-alpha, and IL-8. In the beginning of the presentation, if you remind, I said those on the articles and the research so far presented are known as classical biomarkers, but for our population, they are decreasing. These raise questions like, is this a representation that our population it's not responding to the infection, or there is a shift, there's a difference in the response that these participants are building, because we are talking about the innate immunity, the adaptive immunity in action, and this is not happening with these participants. But if we keep seeing, this is the mixed inflammatory cytokine, and it's interesting that they have a different behavior. Those cytokines are increasing are elevated, are exacerbated in our severe cases, and let's take special note to the TGF and IL-10, which I said before that they are anti-inflammatory cytokines, but although they are elevated in severe cases. Again, more questions. What is happening? Is this a response to the exacerbation, to the overexpression that we are seeing in the response? Or these cytokines they have a different role. They are participating in the worseness of the disease. So more questions. And then we took these cytokines one by one, and we correlated with the SARS-CoV biomarkers that I said before. And again, our mixed inflammatory cytokine profile are the ones associated to our SARS-CoV biomarkers. So showing again that these cytokines are important on the evolution for severity. And finally, we wanted to see if we are talking about biomarkers, but can these cytokines actually distinguish our groups, our severity groups? So we did the analysis, and again, our mixed pro-inflammatory cytokines, IL-7, IL-10, IL-15, and IL-18, did the best work, distinguish our mild from severe cases, as you can see for the under the curve below. But it's interesting that IL-15 and IL-18 again, the cytokine that in the previous graph has shown to be more important, is here. It's here together with IL-15, doing this distinguish better than the others. It's interesting to know that there is some research discussing about the importance of these two cytokines when they are shifting the response for innate immune response with the activation of the activation of NK cells, which are very important when we talk about viral infection. So, more questions. So we had a lot of questions, but what we can conclude from this study? In our settings, IL-7, IL-15, IL-18, IL-10, and TGF were found to be associated with disease evolution in severe cases. Those cytokines showed association with known biomarkers of prognosis of COVID-19 evolution. It's important to note that the potential use of IL-15 and IL-18 as disease biomarkers due to the presented ability to distinguish mild from severe cases. So we have here two potential biomarkers that can even be used in immune therapies. And we advocate for further studies. Further studies are needed in the evolution of cellular components. We talk about Tregs. As we saw, there is an increase in TGF-beta, an important cytokine for these cells. We also want to see innate cells, since we have an increase in the production of cytokines such as IL-18, important for the innate immune. And we want to combine this information with the cytokine secretion. As a study limitation, as you could see, we didn't consider the negative case controls because they are not perfect. You could not consider these participants perfectly healthy. They come for, as I said in the beginning, they come for the SARS-CoV surveillance, and they presented some symptoms. That's a limitation of the study. Our acknowledgements to the WSD, UNESCO Organization, Hospital Central de Maputo, Hospital Geral do Plano Caniço. Tabonga, muito obrigada. Thank you for the attention.